Well, this is a special moment for me. And I have to tell you why. Last year, I was on the search committee of the Community Services Board. And I was really excited to be on the search committee. The first, we got about 100 applicants. And we screened them and scored them, interviewed probably about 20. And this was in a 4-month period. None of them worked out. I mean, after interviewing, it was no. We started again. We got another, I think this time 150. And I said, if this doesn't work out, obviously I can't do it, so I'm going to not be on the screening committee. But as I'm going through these applications, I see one that was really a shining star for me because, well, and maybe this person was someone who had been on the board of some of the agencies, the national agencies that I had been on the board. He was doing some things in the community to build community empowerment. He really understood quality, and he was trying to bring the community together and provide quality services, and he was staying in the forefront of what we all should be. Not what our money allows us to do, but what we should be doing. And I said to the search committee, we have got to interview this young man. And then something happened, and I didn't make it for the interview, but he was a shining star. Please, come in. Let me tell you a little bit about our Jim LaGraffe, who is the executive director, and he has been with Rappahannock, Rapidan Community Services since April 9th, 2018, relatively new. I'm sure he's going to tell you, but the Community Services Board serves 5 counties, and Orange is one of those 5. It's Rappahannock, Madison, Culpeper, and Fauquier. I'm not going to tell you where he was born. He was born in, this says Syracuse. He wasn't born in Syracuse.
That's a lie. I was born in Syracuse.
Oh, you were born, but he didn't live there.
Liverpool.
Okay. But most recently, he's been a resident of Pennsylvania in the Harrisonburg area. He worked in Keystone Human Services, which is a very large human services program in Pennsylvania. He was the executive director. They employed 1,800 staff. That's a large organization. And they had more than 400. I'm doing this. They had more than 400 locations. Let's see. He participated in many statewide initiatives. He did da-da-da-da-da-da-da. He earned his bachelor's degree in elementary education from the State University of New York. He completed all coursework to his master's degree from the Maxwell School of Citizenship at Syracuse University. I sit on the board, and I have been most pleased, as the other board members, in terms of his development, his knowledge, his mentorship of staff. He knew what the training was important. He knew that getting out and talking to your peers, was important, and he has brought that to Rappahannock, Rapidan Community Services. Without further ado, please join me in welcoming Jim LaGraffe.
Thank you. What Donaldo did not say about any of that, though, was when I got a phone call from Rappahannock Rapidan Community Services, and our main office is in Culpeper, but we serve Orange, Madison, Fauquier, Rappahannock, and some county I'm missing. First thing I did, of course, was look up Rappahannock Community Services Board, which is in Fredericksburg, which is a whole different company. And so I came to the interview prepared on an agency that I wasn't even talking to. So that's she didn't mention anything about that. So, and I was curious, like, they just hired a new director. Why are they hiring and interviewing me for a director and all that type of stuff? So I very much appreciate being here this morning. For me, I still consider myself very new to the role. Our organization is a very complicated organization. We'll talk a little bit about some of the services that we provide and that we do, but our interaction with the community, I still find myself, I'm very much in a learning process still at this point in time. So being here today, I really am hoping today, I'll talk a little bit about our organization, but really what I would like to talk about most and hear from you about what we can do for you as an organization, how we can help you, how we can help Link, questions you might have about us, and really so I can learn, so that when I go back to the office, that I can make sure that we're doing things that are working for everyone here. All right. And if you have questions, I probably won't know the answers yet too. I was talking to one of our board members the other day, we're at another meeting, and people kept asking me questions that I didn't know the answers to. He said, I need one of those whispers behind me to say, like, we're at a congressional hearing. So we are Rappahannock Rapidan Community Services, and that's our little logo up there. So as far as our organization, the mission of our organization is to improve the quality of life in Culpeper, Fauquier, Madison, Rappahannock, and Orange counties by providing comprehensive behavioral health, developmental disability, substance use disorder, and aging services. And you can see on the right, our board of directors right now, we are actually organized as a 5-county organization with board members that are appointed by members of local government, by our boards of supervisors. And so I'm very happy that 2 of the board members from Orange County actually are members and live in Lake of the Woods. Benaldo, obviously, and we have David who's in the back taking some photographs. I think everyone knows David. So. We are actually a very unique organization as a community services board. There are 40 community service boards throughout the Commonwealth of Virginia, and the Community Services Board was actually developed in the Code of Virginia as the single point of entry into publicly funded mental health, developmental, and substance abuse services. Okay? And so you see, as the Community Services Board, we provide community-based mental health services, crisis services, case management, hospital diversion, and some other stuff, and we'll talk briefly about those. But what makes us truly unique is that we are also the area agency on aging for the same 5-county area. Okay? There are 20, I think there's 25, 24 or 25 area agencies on aging through the Commonwealth of Virginia. And we are the only such organization that combines those 2 roles. So it's bad enough you got to learn all about being a community services board, but I also got to learn all about how to be an area agency on aging. And as community service boards are actually very rare nationally, this is a model that is not, I think there's 4 states that do the community service board model. I would guess, I don't know if this is true, but I say it anyways, because we are the only one in Virginia that combines this. I bet we're the only organization in the nation that does both the things that we do the way we do. So we're very unique. As the area agency on aging, where community service boards are developed by state law, area agency on agings are developed by the Older American Act. And the area agency on aging focuses on supporting people who are 60 years or older, who are at risk of isolation, institutionalization, and again, people of low income minorities. And we'll talk a little bit more about that as well. So, in the area of mental health, we provide crisis services. And that's one of the things that we are actually mandated by the state of Virginia to do. So if somebody in our 5-county region is having a mental health crisis, and the family is concerned, Calls the police. Typically what happens is they would call the police because they're afraid of someone hurting themselves or someone else. The police respond. And again, we don't want to arrest those members of our community. You know, mental health disability is a medical issue, right? So we actually have an assessment center. It's on the grounds of Culpeper Hospital. It's a little separate building where local law enforcement will bring members of our community who are in a crisis, and our staff will take custody from law enforcement of that individual. And while they are there, we have licensed counselors who will do an assessment on that person to make a determination, is this person safe to return home or not? And if they are, then we develop a safety plan and we get their families or other members who to support that person to get that person home to make sure they're safe. But if in our counselors, and it's a very rigid process, kind of criteria that we go through, makes a determination that that person is not safe, they're either harm to themselves or others, our staff will go in front of the local magistrate and petition that that person needs to be hospitalized. And typically it's against their, kind of without their consent. And that's why we get the magistrate involved. And so then we will help that person get the help they need and return back to the community. So that's one of the things that we are, by the statute of Virginia, mandated to be the provider of. But through the history of our organization, when we started, because we were such a rural area, we're still a very rural area, but if there were services that were needed, there weren't other agencies to provide that service. So as an organization, we have filled that void. So we're not just doing mandated services, but we're also providing other needed services in our community, such as behavioral health care. So on the grounds of Fauquier Hospital and on the grounds of Culpeper Hospital, if a member of our community needs psychiatric, mental health, substance use disorder services, and needs to see a clinician, we actually have clinics where people can go, they can see a psychiatrist, they can see a psychologist, they can see a therapist, they can be members of groups and those types of things. And so we do that as well. We run a program called Boxwood Recovery Center. Boxwood is a residential addiction treatment center. It's a 28-day program where members of our community go, receive support, hopefully to get overcome their addictions. We do some children's behavioral health support coordination. So if there's little children in our community who are having behavioral difficulties, we do that case management to make sure that those kids and those families get the support they need. We run what's called the infant and toddler connection, which is for little ones. If a little one is born with maybe cerebral palsy, needs some physical therapy and those types of things, we do those screenings and intakes and referrals for people. We do what's called young adult coordinated care, which is for a lot of times people with mental illness, especially serious mental illness, they see their first kind of break in those adolescent years. And that's really what that program really tries to do, is help those individuals first onset of mental illness. And then we do all prevention services for the five-county area. And by prevention services, we have case managers, we have clinicians who go out and talk to schools and kids at schools about the dangers of drugs, how to recognize mental illness in themselves and in their peers. And frankly, it's one of the best things that we do. I got an email about a month ago. One of our prevention counselors did a presentation to fifth graders at one of the local schools. And he's a set agenda that he talks about. But that afternoon, we had 24 students show up at the guidance office saying, I either have thought about hurting myself, a friend of mine has talked about hurting themselves or others, a family member, I need help. And again, I really think that program in particular, only a couple staff, but they see hundreds and hundreds of kids every year. And that is the effect that these speakers have on these kids. So these kids, without him, maybe some of them would have come forward, but I bet a lot of them would not because of the stigma that is associated with that. So those really are the mental health and substance use services that we provide. We also provide supports to individuals with intellectual and developmental disabilities. And so what do we do there? Well, we do a lot of case management. So if a family has a family member who has an intellectual disability, and they need to know what services and supports that family member, we have case managers who do that work for people. We have a day program, because that often is a big concern for families, is they have a family member, because of the nature of their disability, they can't stay home safely, and parents need to work. So we have a day program that, we work with people during the day to help develop skills so that they can live as independently, maybe develop skills so that someday they can get a job, those types of things. We run what we call them congregate residential programs. We run some group homes. So homes in our community where people live together as a family, and it's usually about 4 people. And we have staff who support those individuals to live, comfortably in their communities. And we do some nursing services and all those other types of stuff, lots of little services as well. And the other big area that we provide support is, I lost myself there, okay. Is services for older people, so they can live happy, healthy, and as part of the area agency on aging. And so in that area, the things that we provide are things like, we have adult day health care. We have a program that if someone is living with someone who's elderly and might need some medical care throughout the day so that their caregivers can go to work and those types of things, we have a place where people can go. It's overseen by a nurse, and people can go and get the care they need during the day, and then we transport home at the end of the day. We do disease prevention programs. So if seniors in our community are living with chronic health conditions, we have staff who will go out and teach people how to manage their diabetes, how to manage pain, all those types of services. One of the bigger services that we have are home delivered meals. So I can't say Meals on Wheels. People heard me say this because Meals on Wheels is trademarked, like saying Kleenex is really facial tissue. So we have so we have a home delivered meal program where we actually have volunteers, it's mostly volunteers, who will bring meals to members of our community who, for one reason or another, cannot get out, get their own meals. But then we know at least 4 or 5 days a week that person's getting a healthy, nutritious meal. And additionally, what we know is that someone is interacting with that person on a weekly basis. So that, we have that kind of heads up that, I went out to deliver John's meals, John wasn't looking too good. They call one of our other workers, and one of our workers maybe makes a phone call to the family or something like that to make sure things are good. But then, and for a lot of the people that we deliver home delivered meals to, especially because some of the more rural counties, I live in Rappahannock County, so I can kind of talk about Rappahannock County a little bit. A lot of those roads are gravel roads, you don't have a neighbor for a long way away. So our drivers will go up there, deliver meals, and we make sure that nothing bad is happening to people at those sites. We run the Housing Choice Voucher Program. Those are just housing vouchers for people with low income so that we can make sure that people have acceptable housing. And one of the things that we do under the voucher program too is we actually have a small apartment complex that is for seniors of low income. And we have 24 apartments in that complex. We have a staff who is there to keep track of people. And again, making sure people who are very limited income can continue to remain independent in the community. We run a transportation service. I think probably a lot of people have seen our big white vans. You know, these big white vans with blue bumpers that say Rappahannock, Rapidan Community Services across them. So for all of the services that we provide, we have a fleet of vehicles that will take people to senior centers, will take people to the day programs, take people to medical appointments, whatever they might need as well. And we do that either free or through, if someone's on Medicaid, we will bill Medicaid for those transportation. We have our senior centers. So in every one of the 5 counties that we operate, we run a senior center. And we call them senior centers, and they are predominantly for seniors, but one of the other aspects of the senior centers is that they're also meal sites. So for people who might not use our home delivered meal program, they might actually come to our community center, our senior centers. At that point, they again can get a free meal, at least once a day that we know is healthy, nutritious, meets dietary criteria and all those types of things. I think last year we did 53,000 meals out of our congregate meal programs. we talked about, well, we didn't talk about, but we run what's called No Wrong Door. And I have brochures over here somewhere on No Wrong Door. But No Wrong Door is a single point of access. So if anybody has a question about services for a senior, you can call one phone number. And the person that answers that phone can get you to wherever you need to go to get the help. And if you allow them, they can actually make the referral. So if you're worried about your mom, or you're worried about your dad, and you're worried about them not eating well, and you think maybe they should do a home delivered meal program, we can give you the number to call. It's the same number, frankly, but that's a different story. Or you can call that number, and we can, right on that line, make the referral so that home delivered meals can be initiated right in that spot. Okay. We do, again, support coordination and option counseling. That's really for seniors who need some case management support, and make sure that if they need services in the community, that they're getting the services that they would need. We have case managers who are specifically trained and work with our senior population. One of my favorite programs is the Virginia Insurance Counseling Assistance Program. We always call it VICAP. If you're on Medicare, call us, okay? We will sit down with you, and we have staff who are specifically trained to review your Medicare policy to make sure that you are getting the right policy for the best price. Last year, we saved seniors in our 5-county area, I think it was $274,000 in premiums by choosing the right Medicare providers. Okay. And lots of volunteers and coordination and all those types of things. So we have 71 different programs the last I knew. So I've only just touched on a few of them here. Okay. But as far as the numbers of people that we support, just to get an idea of the reach and the impact of our organization, you'll see here in our outpatient clinics for people with a mental illness, we saw last fiscal year, we'll update these years at the end, numbers at the end of June, we saw over 2,000 people come to our clinics for counseling, psychiatric support, medications, those types of things. We provide case management to, well, what, 1,200 people maybe? To make sure that the services that they have in our communities are valuable to them, getting what they need. We provided early intervention services to 444 little kids. So, again, we know early intervention means later in life, much better outcomes, right? And you can see, I'm not going to go through the numbers, but we support a ton of people in our community. I think a lot of our board members, one of the things we always say when new board members come on, they're kind of overwhelmed at what we do and the breadth. And we like to say we're one of the best kept secrets in the 5-county area. We're also the 6th largest employer in the Culpeper area, but that's a whole other story. Our senior centers, you can see, we have about 400 people who regularly attend our senior centers. Okay. We have provided referral services to over 700 people. Our adult daycare is small, we only got 12 people who attend. But we deliver home delivered meals to 173 people, and we provide transportation services to over 400 people for our community. And I know you probably can't see this at all, but this was a chart that we put together last year for the fiscal year, our business year that ended. It talks about the Orange County Nutrition and Volunteer Program. So if we're just talking about Orange County, what is our impact with our seniors? We have 49 people who attend our senior center on a regular basis in Orange County. We delivered 4,276 meals were served there. And we have 24 people who received the home delivered meal program. So probably a little lower than some of the other counties comparison-wise. But we have 22 volunteers at the senior center who come on a regular basis and provided over 1,200 hours of volunteer support. We provided 555 caravan trips. Okay. We had 354 volunteer hours of food collection and lunch transports. And then we have 2 volunteers who provided 384 hours of, we call it PMMP. It's really, if you have a member of our community who's a senior who needs help with their finances, we have some volunteers who are trained who can help family members kind of get your finances managed and work back out. Just our operations, so last year, we're about a $26.5 million organization with about 350 staff. People always want to know where our money comes from, right? So we get about $6 million from the state. We get $400,000 from the state for aging. That's all. All of those meals, we get $400,000 from the state. Our local governments give us about $1,200, almost $1,300. So for lack of a better term, charge each county that we operate $6.69 per member of your census. For all the work that we do. Our biggest revenue source is fees, about $10 million. And our fees come primarily through Medicaid billing. That's what our fees are mostly about. Federal government gives us about $1.8 million and about $700,000 for aging services from the federal monies. And then a little bit here and there from other places. Again, it's a little small, but really just kind of talking about who are the people that we support, and this one's probably a little more interesting. These are the individuals served by our organization in the Area Agency on Aging. So for most of the referrals are for information and assistance, but you see meal programs. Again, this blue is about a quarter. So about a quarter of the people we support in aging are in poverty. And a large percentage here of the people we support in aging, as you would expect, are 65 years of age and older. And more women than men. We draw a lot more women than men. And that's how you can get a hold of us. If you've never gone to our Facebook page or our web page, all of this information is on there. We're a private, not-for-profit corporation that is chartered by local government. So it gets really confusing at this point. So in our agency, because of our charter from local government, everything we do is visible and transparent. Our board meetings are open to the public. Anybody can come at any point in time. Our meeting minutes, all that type of stuff, all of our financial information is all available to the public. So if anybody ever has any question on who we are, what do we do, where does that money go, it is all open and available to anybody who would ask. The other thing that I would say too that I think is really important, as Donaldo said, I came from a very large not-for-profit organization, and we covered Pennsylvania, Delaware, Connecticut. We had an office in the country of Moldova. We had an office in the country of India. And so we were very broad, and we're a good, well-run, not-for-profit company. But when we made decisions, we made decisions, what was the best long-term interest for the company, right? Because that's kind of what you do. Because we are chartered a little bit differently, the Community Service Board is a model, and by connection to the Area Agency on Aging. My board of directors, who I report our performance to, are actually appointed by elected officials. And so when I make the decisions and when we as an organization are looking at what we're doing, there is a much greater connection to local community need. So if Donaldo or David come onto my board, they're there because they have an interest in the local community need. And they're going to hold me accountable as an organization to make sure that we are changing paths to meet those needs. And so I think sometimes people don't quite understand the CSB and the Community Service Board model. But I will say I've worked a lot of different places, worked at multiple states. It is the best model of support I've seen because you are never allowed to get too far away from what your community wants and needs. That's what we're here today, right? So you're members of my community that I'm really charged to represent. And so it's really important for me to hear, what do you want? What do you need from us? as the Community Services Board or as the Area Agency on Aging. And then it's up to me to make sure that we're meeting those needs. And I'm charged to do that. I'm motivated to do that because frankly, this is the nicest area I've ever lived. It's a beautiful area to live. And I want to stay in my job for as long as possible. So that's kind of us as an organization. And like I said, I really hope people have questions, discussions, and I'm here to answer those for anybody asks.